The coronavirus has become a center of attention for all of us in Boston, and that includes members of the City Council. After starting a new term in January, some councilors worked on their agendas, but the virus has meant a focus on other critical needs among homeless, people struggling with opioids, and students in the Boston schools. Over the past few years, those areas have also been a focus for our guest, City Councilor at Large, Annissa Essaibi-George. Thank you very much for being with us, Councilor.
Oh, it's my pleasure. Thank you for the invitation.
Also, you have a history. You've been a teacher, you're a parent. What has the change with COVID-19 been like for your family?
So for us and for our family, my 4 boys, my triplets who are in the 8th grade and my older boy who's in the 9th grade, we're still in this novelty stage. It's only been a couple of days. The boys did go to school on Monday. We're able to meet with their teachers, get their belongings, and we've gotten to the point where we've set up little workstations at home. But we're still waiting for some of the more substantial work to come. And they've had their things ongoing. But this week has still been more of a novel week. Understanding what the expectations will be as a family, that it's not, they've referred to this as their vacation, and I've had to remind them that it's not a vacation, that it is still school time, and that there are certain things that I'm requiring them to do, that school has required them to do. But we're working through it as a family, and I think by the end of this week, we'll be in a better rhythm and in a better place as a family.
You know, there are some parents, if they see their child go off with a Chromebook and don't make too much noise, they're relieved, but you probably have to do more than that to make this work, don't you?
Yeah, no, and if you follow social media, there's there's been a little bit of fun had with this whole notion of homeschooling, and as a former teacher, I never had an interest in homeschooling my kids, and so this is an adjustment for all of us and for so many families across the city, and we've had some fun with it, but there are many families that circumstances are much more difficult, and my boys are a little bit older, so there is this, if they're quiet and they're not fighting with each other, things are good in the household. But when we have families with younger kids and we have families with children that have significant special needs, we as a city have been working to make sure, especially over this week, and the tireless efforts of our school department and our superintendent, and the tireless efforts of our teachers who are on the ground. My sister is a guidance counselor. She's incredibly worried about her students and concerned about their well-being in the coming weeks. Again, we're still in this sort of novel stage of this novel coronavirus, but in this new period of time where, as much as I can make little jokes about what's happening in my own household, I know across the city families are really worried about making sure kids have access to curriculum, access to a rigorous academic plan so that kids don't lose too much over this time, but really that kids are safe, that they have access to learning, and that they remain connected, because we talk a lot about isolation, and for parents, we want our kids to socialize. We want them to have healthy relationships with their peers, but that just isn't the case right now, and it can't be the case right now. We want to keep our families, all of our residents safe during this time.
We've heard about free Chromebooks, at least affordable Wi-Fi, but I do wonder, do you think there might be some gaps out there where people just don't have the whole equation to tap into that?
Yeah, no, we're absolutely going to see gaps, and those will really show themselves by, I think, the beginning of next week, as the academic packets are getting into the hands of all of our students and their families, that Chromebooks are being distributed across the city. We'll now start sort of shifting from this time of transition to a time of more seriousness around supporting our students, and our superintendent and her team and the mayor's team quite frankly, have been working endless hours to make sure that our kids and their families have the resources they need, both from an academic perspective, again, as a former teacher, as a parent, as chair of the Council's Committee on Education, that is so critically important to me. But we've got so many pieces of this puzzle that we are putting together in a quick way, but in a thoughtful way, as this crisis, as this virus really starts to show itself in a real way in our city.
During this week, you've been going to those updates by the mayor outside City Hall. A lot of things we keep hearing over and over again. Is there anything particularly you want to make sure really gets through to people?
Yeah, I'm grateful that the mayor has had those press conferences. He spoke the other evening to Bostonians across the city of Boston on network TV. Those press conferences have really been, I think, a helpful way to share information. He's had a daily call with the Boston City Council. We've had one every morning. We had a few last week in person. We've shifted to online. And so that partnership and that ability to work together has been really encouraging and demonstrates to me the mayor's desire to get through this together and to get through this crisis together. One message that I hear over and over, well, there's several of them actually, that we've heard and we've talked about how critically important they are. But for starters, this idea of social distancing, staying home, if you do have to be out, this is a very healthy distance. We probably should be a little bit further apart.
Yes.
But being with your family and not really extending relationships outside of that family unit, washing your hands, using hand sanitizer, so critically important. But another message is not calling 911 unless it's a true emergency. We don't want to overwhelm the 911 system. We want to make sure that our first responders get the calls that they need to get so that they can respond in a timely manner. If you think you are sick, if you think you have been exposed to COVID-19, if you think that you're potentially carrying this illness, that you should be calling your primary care doctor to set up, to be triaged, to set up an appointment to be tested. If you don't have a primary care doctor, call 311. We'll connect you with the Health Commission, and they'll advise you on what steps to take next.
Now, of course, in many cases, we're talking about people who have these common symptoms that they would just stay with at home. Now with COVID-19, they might panic and say, oh, I guess I got to go to the emergency room. And the reason why we don't want that to happen right away is what?
Well, we don't want to overload our hospital system. The capacity of our hospitals and our healthcare system isn't limited at this point, but it could be. So we want to make sure that people aren't doing that first. We also want to make sure that if you are a carrier of this COVID-19, if you do have the coronavirus, whether you show symptoms or not, that you aren't spreading it. We're trying to contain that spread. And that is part of the reason around the social distancing. This is why we've put a call out for anyone who can work from home to work from home. It's critically important. It's why we've canceled school. We want our kids in school. I want my children in school every single day. It's so important for kids to be in the classroom with their teachers, with their classmates, both for the academics and the socialization. But we know the spread of this virus and how contagious this virus is. It's important for folks to be at home and not out in public as much as possible.
Long before this broke out, you had concerns about the safety net in a couple of areas, at least. The opioid crisis, homeless families. How would you see them affected right now?
Well, we know that our population, our residents in the city that are experiencing homelessness are a vulnerable population, that they are at a tremendous risk to not just catching the coronavirus, but spreading it among that population, because they often are in tight quarters. It's much more difficult to maintain these social distancing practices that we're calling for. So through our Health Commission, through our Department of Neighborhood Development, in partnership with Healthcare for the Homeless and so many other agencies and organizations, there's been a great deal of effort to put in additional hand washing stations at both our shelter, at our engagement shelters, at our engagement center, at some of our service providers, because we know that that's a critical thing that needs to happen. You'll see that the mayor has worked quite quickly at erecting 2 new tents near our engagement center so that we can create some more space for our individuals who are experiencing homelessness, who are also often dealing with a substance use disorder, who also have a co-occurring mental health disorder, and making sure that they have access to care, that we've been screening our guests as they come to our day shelter, as they come to our evening shelters, and we're preparing for what will likely be an inevitable few positives within that community. And how do we contain that? How do we manage that? How do we make sure that an individual gets the care that they need quickly? And we've been, and the mayor has been leading the way on making sure that we're responding, that we're prepared for that response in the coming days and weeks.
What I've also noticed from following some of the counselors on social media are these different ideas about constituent services, whether it's a dialogue with a therapist or maybe having food items dropped off. I think that was your idea, wasn't it?
Yeah, no, we have we've come quite a long way today, actually, for our weekly city council meeting. It was a hybrid of some off-site, some on-site, utilizing online technology. Next week, our council meeting will be 100% virtual, 100% online, still viewable to the public. The city council chamber was closed to the public today for our meeting.
We should mention this is being held on Wednesday.
Yeah. Yes. So today being Wednesday, and our meeting next week will be 100% virtual, where I'm in the middle when we think about my ability to use technology. So this week I've used Zoom 2 or 3 times. I've never used it before, so I'm learning, and it's an exciting thing to do, to see that we can do things differently as a council, and we're responding to this crisis. We're adapting our protocol, we're adapting our policies, and Council President Janey has really worked to get us to this place. And it's an unfortunate crisis, but an interesting time to be a part of the City Council and to understand the different ways that the public can interact with us during this time. My office at City Hall is now all working remotely. We have the ability to forward calls, obviously check emails. My staff has also been volunteering at some of the food locations across the city, because one of our concerns around the schools, we talked already about the schools, but when we had the conversation and the mayor had his deliberations around closing our schools, one of our greatest concerns was the number of kids that rely on the meals that they receive during the day. So we, and through his leadership, have been able to, as a city, make sure that we've got these food distribution points across the city so families can access food and our kids can access food. So my team has been volunteering at a few of those locations in their neighborhoods these last few days, and will continue to do that for the foreseeable future.
Thank you very much for being with us.
No, thank you.
City Councilor Annissa Essaibi-George. We'll have more news in just a moment.